something that I always remember is that every patient is different, and that knee and hip replacements are elective surgeries, and that means that patients elect or opt to have the surgery. So it's not a life-saving surgery that needs to happen. It's really a decision between the patient and the surgeon of when it's time. So every patient will elect to have a surgery at a different time. In general, I tell my patients to start thinking about having surgery when the joint really starts to affect their life on a daily basis, and then they've tried other things and those things are no longer helping. So some of those things we've already talked about, things like weight loss, if you have excess body weight to lose, muscle strengthening, getting good sleep, taking medications perhaps to help with the symptoms, sometimes even injections into the joints. So all of these are things you can try before we go down the path of surgery. When those efforts fail, however, patients can start to think about considering surgery. So some patients, I think, opt for having surgery when, for example, they have a lot of pain at night and they're no longer able to sleep, or maybe when the pain is prohibiting them from doing activities they love. So it's really varies, and patients also have a different threshold for pain. So the decisions, it really tends to need a discussion between the surgeon and the patient, and everybody's timeline for readiness will be different.
Yeah.